Hello, ladies and gentlemen. My name is Senjimana Jean-Pierre. Today, we are going to talk about electronic health record. Electronic health records are the electronic representation of patients' medical history by health care providers through time. So, what is exactly health electronic record? So, it contains all main administrative, clinical data relevant to patient treatment under the certain provider. So, patient demographic, progress notes, issues, prescription, vital signs, past medical history, immunization, laboratory data are all included in the electronic health record. So let us see the components of electronic health record with the support direct clinical care. So the first one is the medical history. So it facilitates direct clinical care since it contains the information about patients' medical history. For example, the results of physical tests. Also, the second one is the patient demographic. It facilitates the the direct clinical care since it includes information on patient demographic, gender, date of birth, and the ethnicity are all few examples. So let us see what are the what are the advantages of electronic medical history. So the first one, it reduces it reduces the upfront cost. So paper records requires to purchase paper files and the establishment of lockers to store the medical history, but electronic health record electronic health record do not require to purchase those items. When you compare the paper records to the electronic health record, electronic health records are less expensive. So the second one, it is easy to use. This is because use of technological device is simple to obtain information contained in files by checking previous notes, medical charts, and even recording the fresh observation. So let us see the issues involved in the record of the medical history electronically. So the first one is the security issues. Medical institutions are concerned about potential dangers to the medical information. Hackers are there to breach security in order to steal the data. So people who work as technicians, on the other hand, have the potential to breach the security. So the second one, the privacy and privacy and the confidentiality to preserve the patient's privacy and the confidentiality. Their medical history should not be disclosed. However, as the result of clinical engagement, some healthcare providers will do some healthcare providers wind up disclosing patients' information. So let us see the advantages of recording patients' demographic. So the first one, it reduces the inequalities in healthcare across various population. Patient demographic assists the healthcare practitioners in a different patients' expenses based on the race and the ethnicity. So the second one is it assists in the formulation of the public health policy. The recording of patients' race, ethnicity, and the language aids in illness and the therapy research. So let us see the problems of recording patients' demographic. The first one is the lack of all necessary elements because manual systems were previously used. Most patients in a clinical electronic health electronic records lack all the requirement elements to meet the meaningful use of for the requirements. So most physicians record the gender and the date of birth, but not less ethnicity, language, which increase the work for healthcare practitioners to determine the patient's race and the ethnicity. So the second one is that in certain societies, asking someone name, asking someone's name, ethnicity appears outdated. So, for example, in Burundi, all people speak one language called Kirundi. This makes it different to record all the demographic data. So let us see, you can ask yourself, what are the two components of electronic health record that support administrative process? So the first one is the registration. The registration component cover the patient's classification and the analysis of well as analysis as well as the demographic next to scan employers information. So also the patient disposition and the principal component. So the second one is the discharge. It includes information such as the reason of hospitalization, significant findings, procedures, and the therapy provided patient and the family instructions and the significance of the attending the physician. So let us see what are the advantages of registration and the administrative process. So the first one, it enhance the carrying out registration electronically reduces the critical errors that may rise when healthcare professionals enter the data manually, and it makes it easier for administrator to examine them. So the second one is it helps in time management. Electronic registration saves time since healthcare providers offer the electronic form to the patient and instruct them on how to fill out, allowing them to submit their work on time. So let us see the issues of digital patient registration. So the errors in the data input and the comprehensive are caused by the poor and interface design. So, for example, electronic health record device and the infusion of device may use various techniques to the to present the patient's identification information result in the data mistake. So the second one is the due to the lack of consistent method of users to the to provide the data, patient registration has become difficult and ineffective. Also, let us you can ask yourself what are the advantages of associated with the discharge. So the goal of discharge is to maintain the quality care community between the hospitals and the community. So it improves patient satisfaction as a result of the care they receive in the hospital. So there is the goal of discharge is to minimize hospital length of stay and the unscheduled 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 readmissions. So let us see what are the issues associated with the discharge. So time interval issues. It has been highlighted that there is a problem with the organizing the presence, the election, and the degree of emergent medical records, which forces healthcare workers to make time travel errors. Also, inaccuracies in the medical record. The emergence department activities parameters have the reverted has the revered in currencies in inaccuracies in the procedures. So let us see the importance of integration of administrative and the clinical areas for effective use of electronic health records. So there is the integration of administrative and the clinical domains enables and the administrators and the administrators and the clinical staff to monitor and the practice data in a consistent manners. Also, the integration of administrative and the clinical sector enables for the monitoring and the analysis of the performance through the organization. Thank you for paying attention for this video.